Okay, hello guys, good evening. We are starting with this Ophthal instruments quiz discussion, instruments and investigations. So let me just wait for some of you to join. Okay, so we'll start with the first question. So the first question in the quiz was the most sensitive investigation to diagnose an early KF ring. See, Kayser-Fleischer ring is that golden brown or golden yellow ring which you see just within the limbus, at the limbus, because of the deposition of copper in Descemet's membrane, right? Now, this particular question which says the most sensitive investigation to pick up a KF ring, that to a very, very early KF ring. It's actually a previous year question asked long time ago. Most of you have marked slit lamp. See, on slit lamp you can see, but the thing is, along with the slit lamp, you need a gonioscope to see a very, very early deposit of the copper, that is KF ring. So very sensitive for when they've said they've used two words here, most sensitive, and they've also said early KF ring. So the answer is gonioscopy. So on gonioscopy, you can see the Schwalbe's line or the Schwalbe's ring, which is a peripheral termination of the Descemet's membrane. So that is where you will see the early KF ring, even before you can see very evidently on slit lamp. Okay. So the answer to this particular question is actually gonioscopy. So please make a note. The most sensitive investigation for very early Kayser-Fleischer ring is gonioscopy. Okay, so not just slit lamp. Of course, gonioscope is used along with the slit lamp. So the best answer in this case is gonioscope. Okay, now this was the image that I had given. So this is the image of the left eye because it says OS, and this is a corneal topography. So what is the finding on this investigation reveal? So what is the diagnosis basically? So this is corneal topography where this is the geometric center. Okay, so inferior to the center, that is in the paracentral area, you can see the very hot colors, this reddish, pinkish, purplish, maroonish colors. So that means this area is very, very steep, and you can see the K values also. See, the K values are 61, 57, which is way higher than the normal keratometry readings. So the normal corneal curvature is somewhere between 43 to 46 diopters. That is your normal K. Whereas here it is way higher, and it is in the inferior paracentral region, the steepening, corneal steepening, which is very, very typical of keratoconus. So the diagnosis is keratoconus. Okay, so the inferior paracentral ectasia or the inferior paracentral steepening with the high K values. So the options that were given was cornea plana. See, cornea plana means a flat cornea. That means the K value should be lesser than the routine, the normal K. No, normal K is 43 to 46. So this is way higher. You get 57 there. There's one place where it is 61. So it's definitely not a flat cornea. So option A is ruled out. Pathological myopia. See, pathological myopia is uniformly the corneal curvature may be increased, but overall it is about the axial length which is increased in pathological myopia. It is not about the K increase per se. No. So that is also not the answer. Astigmatism, yes, there is an irregular astigmatism definitely, but a better answer would be keratoconus. Okay, so that is a keratoconus because you have the typical inferior paracentral steepening. Yes, okay. So watch the video again because I've shown the image. Now macular function tests are all except. So let's go option by option. Option A, Maddox rod test. Is it a macular function test? Yes. Maddox rod test. Yes, it is. Photostress test. Yes, again it is a macular function test. Color vision, yes. See, especially blue, yellow. Red, green is a optic nerve ka function, but blue, yellow is pertaining to the macula. So yes, color vision, yes, it is a macular function test. ERG. See, electroretinogram is not only for the macula; it is for the entire retina. Okay, so it is not a macular function test. Now, some of you have marked, have not chosen it because you confuse it with multifocal ERG. Say, multifocal ERG is an ERG which is focused only on the macular area. So that is a macular function test. But ERG itself is not a macular function test because it is a summation of the electrical activity of the entire retina, not only of the macula. Okay. So the question was macular function tests are all except. So all except ERG. Okay, multifocal ERG, MFERG, yes, it is a macular function test. So given these four options, Maddox rod test, photostress test, color vision and ERG, ERG is the best answer. Okay, like an odd man out. Now, visual acuity may be measured in pre-verbal children by. So, this is an INICT question that came in this November 2025. Landau C chart. See, it's like a Snellen's E. Snellen's E, you have an E and with black leads, limbs and the empty spaces. C is, it's like a C. So, the patient has to show us where exactly that broken part of the ring is. So that is Landau C ring. So for that the patient should be able to speak, should know that this is C. You know, it's not possible in pre-verbal children. Pre-verbal children are little like infants, no, toddlers who can't even speak pre-verbal, you know, before they start speaking. So definitely not Landau's C chart. Teller acuity cards, that is the answer. Let's come to it. Now, optokinetic drum, see, optokinetic drum you can measure in, you can use it in pre-verbal kids, but that is only to see if there's a reasonable amount of visual acuity. And OKN compared to Teller acuity cards, Teller acuity card would be a better answer. Okay, Teller acuity card is, you'll have alternate black and white stripes on a gray background or gray stripes, you know, and with a hole in the center. So it's basically a preferential looking test. So when you show that to a kid and you're looking through it, so you'll basically see if the child is looking at it. Okay, so it is a monocular test, and it's a different preferential looking test, your Teller acuity cards. So the narrower the grating, so it is basically a grating acuity. So it is these alternate stripes. So some are very, very closely spaced and some are broadly spaced. So you'll start with the broader spaces and then go with show the different cards till the child starts looking at, continues to look, or still chooses to look at these very narrowly spaced gratings. Okay, so that is your Teller acuity card. OK and drum is basically if the child has some vision or not. That's it. It won't really pick up the visual acuity. Yes, in adults you can still, or even in children you can, but for that a minimum vision of 3/60 is important when you want to use an OK and drum, okay, for visual acuity. So when you have to choose between Teller acuity cards and your OKM, Teller acuity card is a better answer, and you can use it from since birth to 3 years. You know, it's very, very useful, Teller acuity card. HOTV card. HOTV is H is there, O is there, T is there, V is there. These alphabets are there, and the child is asked to point out which is H, which is O, which is T, or read it. So again, first of all, the child should be able to speak or at least should have that intelligence, and should be at that age where the child already knows to read the alphabets. So HOTV cards, definitely not. Okay, so the answer here is Teller acuity cards. Okay. Now, which of the following tests is not useful to look for Trite anomaly? Now, what is Trite anomaly? Triton is blue. I've told you, tuberculosis. Remember the tuberculosis, TB. So, blue color ka problem. So, blue color ka problem cannot be picked up with which one? Option A, HRR chart. HRR chart is used for blue color. City University test, again it is used for blue color testing. FM Fanson Munsell 100 hue test, yes, it's very sensitive for all the color deficits. Ishihara chart is only for red green color. Okay, it cannot pick up a blue color deficit, it's only for red green color. So that's why we say you can use it only for optic nerve problems, right, or congenital, that is red green. Congenital color blindness is this red green color blindness. So for that, yes, Ishihara is useful for it, but blue color is not useful. Ishihara is not at all useful. So the answer here to this question, which says which of the following tests is not useful for Trite anomaly, which means for blue color problems, the answer is Ishihara's charts. Okay. Now the next question, which is the gold standard tonometer? Absolutely easy question, super duper easy. Goldman applanation tonometer. Almost everybody got it right. So Goldman applanation tonometer is the gold standard for measuring IOP. So tonometer means to measure your intraocular pressure. Okay, next, investigation that is used to visualize all the layers of the retina. Now this is again a previous year question. It is from May INICT, May 2025 INICT. So option A, fluorescein angiography. Angiography is only for the vessels, the retinal vessels and the choroidal vessels, not for the layers of the retina. Option B, indocyanine green angiography exclusively for choroidal vasculature. So again, my question is asking about layers of the retina, all the layers of the retina. So ICG angiography, option B is ruled out. OCT, optical coherence tomography, that is the answer. So OCT is the answer. B scan. B scan, you can grossly see the retina for retinal detachment, posterior vitreous detachment. You can see subtenon's fluids. Posterior segment you can visualize, but not the individual layers of the retina. It is not easy to. It's not possible to see on B scan. So the answer here is OCT. Okay. Now the next question involves an image. So the image is this. Okay. So what is the diagnosis first of all? Although the question is not pertaining to the diagnosis, so you can see a ring stromal infiltrate. So the moment you see a ring stromal infiltrate, and also you can see some satellite lesions. Okay, so ring stromal infiltrate means it is acanthamoeba keratitis. See, you can see the redness, minimal amount of redness though. So this is a ring stromal infiltrate, and definitely satellite lesions are there. Although satellite lesions are not classical for acanthamoeba, the diagnosis is acanthamoeba keratitis. Okay, now let's see what exactly the question is. The question asks, stain used to identify the causative organism of the clinical condition shown in the image. So what is the causative organism? Acanthamoeba castellanii. So you have to stain the organism. So that means you're taking a corneal scraping, you're putting it on a glass slide and you're going to stain it. So option A, gram stain. Gram stain is for bacteria generally, no? It's not exclusive for, it's not for acanthamoeba. Gomorrhe's methenamine silver stain. See, Gomorrhe's methenamine silver stain, some of you have marked it, because Gomorrhe's methenamine silver stain for corneal biopsy. When you take a corneal biopsy and then you want to stain, yes, you can use it. But what is a better stain? Let's see. There's a Ziehl-Neelsen stain, tuberculosis. This is not tuberculosis, no, acanthamoeba. Calcoflow white has got a very good sensitivity and a specificity. So a better answer than Gomorrhe's would be calcoflow white. Okay, so although yes, it is a tricky question when you know a lot. When you know a lot, you're caught between GMS, Gomorrhe's methenamine silver stain and calcoflow white. But to stain the organism, it is calcoflow white would be a better answer. Okay, so that was a little tricky. Of course, that was from November INICT. There. Gold standard for diagnosis of corneal ulcer. This I had already posted on Instagram. Gold standard for corneal ulcer diagnosis is culture and sensitivity. Okay, culture and sensitivity. So that is why the previous question, no, that's also what I wanted to say. See, you don't do corneal biopsy routinely. You don't do corneal biopsy for corneal ulcer routinely. You'll do it only when it is non-responsive. You tried so hard, so long, and nothing is coming out. Then you'll do a corneal biopsy. Only then this Gomorrhe's methenamine silver stain would come to use. So generally, routinely what we do is corneal scraping and staining. So calcoflow white was a better answer. Now coming to this question, gold standard for diagnosis of corneal ulcer, it is always culture and sensitivity. Hi Ganesh, good, hi. Alright, now the next is an instrument. So what is this instrument? So you can see this V-shaped sharp edge. So this is a keratome. Yes. So that is a keratome. So option A, 26G cystitome. No, this is not the needle cystitome. That would be a bent needle which we use for anterior capsulotomy. This is not 26G. No, this is not a needle at all. This is a blade. So definitely not a 26G cystitome. Crescent blade will have a crescent-like tip. This is not a crescent-like tip. This is a V-shaped tip. Okay, so this is like a V. The blade itself is more like a diamond shape. It's a V-shaped. Yes, very good, Pavan. Yes, it is keratome. And what is the last one? McPherson forceps. Does it even look like a forceps? No. McPherson forceps is for your IOL. You hold your IOL and implant your IOL. That is your McPherson's. So this is not McPherson's either. So McPherson's I'll show you on another day. So we've come to the conclusion of 10 questions. All right. So tomorrow we will have Ophthal clinical scenarios quiz, 6 p.m. on Telegram group, and 9 p.m. I'll have the discussion here. Okay, so any questions pertaining to any doubts pertaining to the questions that we discussed today? Like you have a doubt on OCT or Goldman's applanation tonometer, or see, the keratome is basically to do the corneal incision. Okay, as far as you are concerned, undergraduate level, keratome is for a corneal incision. So when you're making a scleral flap for trabeculectomy, to make the flap, you use the keratome. Yes, it is for that reason. Basically for proper incisions, when you want to make the incisions, that is when you use the keratome. When you're doing the AC entry, you want the keratome, all right, or enlarging the incisions. Okay, all right, I think I covered most of whatever you need to know. All right, so see you tomorrow. So tomorrow will be Ophthal clinical scenarios, so it will be all clinical questions, so it will have a longer stem probably. So all the best for tomorrow's quiz, guys, and please look up today's Insta question. It's a very easy but very, very important topic, so go have a look at it. Yes, yes, Bharti Selvan, what is your doubt, pa? So Instagram, please go and take a look at those, and I've also given you the differential diagnosis of acute red eye. Please save it. Instagram, I posted it today, acute red eye. Save it, and every differential diagnosis I will take you through in one of the coming days. All right. Okay, Bharti, you have any question? So any questions pertaining to today's quiz questions? So today is a discussion on instruments and investigations, Ophthal instruments and investigations. My Instagram name is imentor, EYEMENTOR. I think there's a underscore dr.Rajarathna, RAJARATHNA. Okay, imentor underscore. Okay. So I'm asking about today's questions. Today's question did not cover laser, so I'm not talking about the laser. Maybe tomorrow I will include a question on laser, and then we can talk about laser, Bharti. Okay. So tomorrow I will make sure that I will include a question on laser, so that we can discuss about some laser. All right. Okay. See you guys. I'll see you tomorrow. Bye. You're welcome, Bharti. Bye bye. Good night, bache.